So hello, this is Dennis Scanlon from the Center for Healthcare Policy Research at Penn State University, and pleased to have another session of Ask the Experts, where we talk about important issues in healthcare and health policy. And I'm really pleased to be joined today by Jessica Altman, who is the Insurance Commissioner for the Commonwealth of Pennsylvania. So Jessica, thank you for joining me.
Thank you for having me.
So we'll get right into it. The topic of our session today really is on healthcare transparency. And I guess maybe I would start with, in the context of your role as Insurance Commissioner, why it is that healthcare transparency is a topic that the Insurance Department and you as Commissioner really care about.
Sure. So in my role as Insurance Commissioner, I run the Insurance Department, which is the regulatory agency that oversees most insurance products sold in the Commonwealth, including commercial health insurance. And in that role as a regulator, my goal is to ensure that we have insurance markets that are robust and competitive, and that those markets are meeting the needs of consumers. And so at the same time, Governor Wolf and I believe that a critical aspect of that role is providing consumers with the information they need to make informed decisions about their insurance. And when it comes to health insurance, to make informed decisions about their health care.
Obviously, it makes sense then that you would focus on this issue from an insurance department perspective. I was wondering, given insurance, we have auto insurance, we have life insurance, other types of insurance, certainly health insurance. What do you see as some of the key differences, that make the healthcare marketplace a little bit different from the others when it comes to transparency and the needs of Pennsylvanians and consumers?
Yeah, I think the core difference is that with other types of insurance, at the end of the day, your number one hope is that you never have to use it, right? With your auto insurance, you hope you're never in an accident. You hope you never have a fire in your home. You hope you never need that life insurance payout, of course, because that means the death of a loved one. Health insurance is a mix of that. Of course, you hope you never have a catastrophic healthcare event or an extreme diagnosis. But your health insurance is also there to help you with preventive care, to help you with healthcare maintenance, and to help you be a healthier person overall. You don't see that parallel in other types of insurance.
We've seen, I think, nationally and certainly within, I believe, the Commonwealth as well, different types of insurance products, different types of benefit designs in the past several years, some of which may have been supported or followed the passage of the Affordable Care Act. But in particular, a lot of people talk about high deductible health plans or consumer-driven health plans, where some of the benefit designs really require significant out-of-pocket first dollar expenditures by patients before the insurance portion kind of kicks in. And I would imagine that that motivates a lot of people to want more transparent information, but probably for yourself and other commissioners creates additional interest in transparency.
Yeah, I think that's right. I mean, when you have a first dollar deductible, you know that whatever care you choose to get or need to get until you hit that deductible, you're going to be paying the full cost. And so we're not talking about the insurance company's dollar, the reimbursement rate, and you're only paying your copay. This is really coming out of your pocket. That's why we call it an out-of-pocket cost, right? Now, as insurance commissioner, I have to say it comes out of your pocket either way. If the insurance company pays for it, it's built into premium. But that direct cost, having to have that whole cost at the point of service, that's a significant burden to many consumers, and they want more information to make those decisions. They want to be informed buyers of care, and right now they're feeling that they don't have that information. There have been a couple of surveys that show that 50% of consumers polled would like to have better and more cost information available about their care in order to make those decisions in a more informed way. And we're just not doing a good job of providing it to them right now.
So let's talk about that a little bit. Because healthcare is obviously very broad, from acute care to chronic care to preventive care and so forth and so on. Clearly, as you just mentioned, patients, consumers, families are asking for more information. Are there particular types of care where individuals are desiring this information more so than others, or maybe specific areas where providing this care is going to be more feasible than other areas?
Yeah, absolutely. And we use the term shoppable care to describe that. No consumer is price comparing the ambulance that's going to pick them up or the emergency room it's going to take them to, right? That's not something reasonable to expect or think would ever happen in those cases. And certainly with highly technical care, oncology, complex surgical procedures, a consumer's primary concern is going to be the quality of care they're going to receive over the cost. But there are also a whole host of services where the quality variation is really minimal, but the cost variation is really significant. Take an MRI or an X-ray or really common surgical procedures like hip and knee replacements. Those are services that are broadly considered shoppable, where the quality is going to be pretty similar no matter where you go, but you could pay a lot more or a lot less depending on where you choose to go.
Yeah, no, that's great. I know in some discussions with employers that I've spoken with, self-insured employers, is they've looked, you mentioned a joint replacement, knee replacement. I've heard of price variation ranging from $18,000 to about $45,000, for that procedure, depending on sort of where the patient went. So that's quite significant. If you think about other consumables, very difficult to find, that degree of price variation probably in other goods and service markets.
And that's right. And one of the interesting things that the research shows is even with services where the quality does vary significantly, cost is not a good predictor of quality. The more expensive one location is for the same service does not necessarily mean that location is much higher quality. And so providing quality information alongside cost is an important part of the equation for consumers for those services and those healthcare experiences where quality is variable and really, really important.
So that sort of brings me to the question of there's obviously a strong case for this type of information, but we don't have currently, I think what you want, what many consumers want, what many Pennsylvanians want. What would you say are some of the main reasons for that? Is this a lack of ability to get the data? Is this sort of resistance of some groups or some individuals that say, no, we can't make this available? Why is it that we have not had this information at a level that consumers are demanding?
Yeah, so I mean, it is hard to get the data from an operational perspective. It's expensive to run the process where you collect that data. And it is also incredibly hard to take that raw data and present it in a way that consumers can actually use it and make actionable decisions based off of it. But it's also hard politically. And I think the arguments are that burden of providing that data, the cost of providing that data. But also the narrative is about competition. And we often hear the argument that when you make price information available, that could actually result in inflated costs. Basically, that when one provider sees that the provider down the street is getting paid more than they are, they'll call the insurance company and say, I'm not going to take any less than that guy. And then prices rise across the board. Now, I say, of course, that argument goes equally the other way, right? When one insurance company sees another insurance company paying less for the same service, they may call the provider and say, I'm not going to pay you any more than that guy, and then the prices are lower. And in fact, in some states that have made this type of price information widely available, there has been some early research that does not show any of that widespread price inflation that is often used as an argument against truly comprehensive price transparency.
So I guess in thinking about the broader sort of topic of transparency, it seemed like in many ways Pennsylvania was a pioneer to some degree, sort of with PHC4. And now we're still talking about, whether we should or should not do this.
Yeah, there's a lot to unpack there, right? I think there's no question that at the time that the Pennsylvania Healthcare Cost Containment Council was put into effect, the Pennsylvania was really ahead of the game. And PHC4, which is what we call that council to this day, does a wonderful job collecting data, hospital discharge data, doing reports on differences in quality in particular across facilities, but they don't really collect cost data and what insurance companies are paying for their services. And so absolutely, you can save a lot of money in our system by improving quality, by limiting negative outcomes, by limiting readmissions into hospitals. But at some point, we also have to talk about how we pay for care itself. And that's why we're interested in this conversation around the all-payer claims database, which after conversations with stakeholders, the intent was to put that database within PHC4 so that they can do all of that work and really collaborate within themselves on all of that data that they would then have at their disposal. The politics are hard, and these new big things, particularly when there's a cost associated, they don't happen overnight. So I'm still hopeful, but it could take some time.